Skinuva Skin Cream, the case series.
Thank you for inviting me. And I'm Chris Zoumalan. I'm a board-certified oculoplastic surgeon, and I'm also the CEO and founder of Skinuva Scar. And today I'll be speaking about one of our publications that we had in press about gene expression analysis in scars treated with Skinuva Scar Cream case series. So it's a nice transition from Joanna Wu's talk about gene expression analysis. That's essentially what we wanted to talk about in this presentation. So Skinuva Scar Cream is a patented topical formulation that's been around for 4 years now. It's an advanced scar cream formulation using clinically backed ingredients, including silicone cream, hyaluronic acid, synthetic growth factors that are targeted specifically for optimizing wound healing, vitamin C, aloe vera, and Fetal asiatica. These are all clinically proven ingredients together making our product formulation work. One of our first papers published was in ASJ. It was our landmark paper. It was a multi-center clinical trial, a split study where we compared Skinuva Scar to regular silicone cream, and we were able to find that our product outperformed regular silicone cream by nearly 73%, or a twofold improvement. Using the modified Vancouver Scar Study scale, we saw an improvement in redness, we saw an improvement in hyperpigmentation, which is very unique for scar creams, thickness and pliability. So one thing that's special about Skinuva Scar is it integrates and incorporates something that we know as surgeons but don't know so much why. Why do fetal scar tissues not scar? A lot of scientific evidence has gone into evaluating why fetal scar tissues don't scar. And one of the main reasons that we found is based on transforming growth factor beta 3, which is found to be in high levels in fetal scar tissues. In contrast, adult tissues, the scar tissues that undergo a healing process, don't exhibit this high level of TGF-beta3. They actually have a high level of TGF-beta1, but a low level of TGF-beta3. Very fascinating, and this is one of the cruxes of what developed and got me interested in developing Skinuva Scar. There has to be something more powerful out there than just silicone cream. Because you know silicone cream works. It has the ability to hydrate the wound and create a barrier for the wound to heal. But there's more. There's more evidence to show these other ingredients out there help improve scars. And since TGF-beta3 is one of the 3 selective synthetic growth factors that we use. They're not human-derived, they're synthetic. So we chose that for many reasons, which I can talk to you later about. Aloe vera, Fetal asiatica are natural ingredients, they're organic ingredients that have so much effective data behind them. If you go on PubMed, you'll see so much data promoting their safety and efficacy for wound healing, scars, open wounds, and just regular sunburns. Vitamin C, very powerful ingredient when it comes to improving hyperpigmentation, improving collagen synthesis, and an antioxidant. We use an oil-soluble form that penetrates effectively and enhances stability. So, of course, hyaluronic acid. Well, why do you have hyaluronic acid in a scar cream? You already have silicone. Hyaluronic acid is also an effective moisturizer, but more importantly, it also is found in high levels in fetal scar tissues. Helps improve migration of growth factors along the scar tissue matrix. And of course, we have silicone cream. We can't forget about if its efficacy has been shown on and out for many decades of research. What's unique about Skinuva is that it's backed by clinical data. Not just, we know these ingredients have been backed by data themselves individually, but as a whole, this product has undergone exhaustive clinical studies. We have 5 publications current to date, and more to come that effectively show the safety and efficacy of our products. ASJ, we talked about briefly. JDD is another publication which actually showed that in patients that have used Skinuva Scar, their indication for injections such as steroids or 5-fluorouracil dropped by 50%. Journal of Cosmetic Sciences took our publication on for our study on stretch marks. And also ASLMS took our poster presentation on for use of Skinuva Scar post fractionated CO2 laser. So this is a wonderful product to use immediately after a fractionated CO2 laser, chemical peels, and even microneedling. Let's talk about study arm 3, which is the genetic expression analysis paper. This is my favorite study because to my knowledge, there's no prior study that's evaluated scar creams using gene expression analysis. Joanna just spoke about PCA and how they used it in theirs, and I think it's wonderful that more and more companies are doing that because it's objectively evaluating how the skin reacts to a topical product from a scientific, bare bones, scientific objective data. This is, to my knowledge, our knowledge, the first study that used genetic expression evaluation to assess topical scar creams. So how do we do this? So it's only a pilot study. There was only 3 patients we enrolled. So certainly there's limitations to that, but the clinical indicators were very strong. And We included 3 patients that were sent from an outside referring board-certified plastic surgeon that performs abdominoplasties. I only perform eyelid surgery, so it wasn't a patient selection that I can do. But we included them 1 month after the abdominoplasties, and at that time we had them use Skinuva Scar cream on 1/3 of their incision. 1/3 of their incision they used regular silicone cream, and 1/3 of their incision they used nothing. This was an IRB approved clinical study that we did. They came back in a month, and then we performed 2 millimeter coarse skin punch biopsies in the office. Those sites healed really well, and we also added a 4th site of testing, normal baseline skin adjacent to the abdominoplasty incision, just to see what kind of reaction we'd get genetically from normal tissue that's not been affected by a traumatic incision, right? And those specimens were sent out for evaluation at a genetic expression lab. Theoretically, we know that a better healing scar should have a decreased collagen type 1 response. So they should have the lowest genetic expression of collagen type 1. They should have the highest collagen type 3 response. They should have a decrease essentially in their collagen type 1 type 3 ratio. We're well aware about that from my biochemistry days in medical school. And also, one of the caveats is to all have a decreased fibroblastic response. So just in general, what we did here was we sampled these 4 locations, sent them over for genetic expression data, and there was literally thousands of genes that came back that were elevated. So we identified 86 that were actually statistically significantly different among these 4 locations. And out of those 86 genes, we identified 7 that actually played a role in wound healing. Actually 7 that played a role in scar management. So really fascinating. One of them was type 1, so we found it. So there was a difference in collagen type 1 among those scars that we treated with Skinuva Scar, exhibited the lowest type 1 ratio. So in terms of showing you that the purple graph, that is Skinuva. The green is just regular silicone cream. That orange to the left is untreated. The middle bar is the median of those 3 patients. So we're looking at the middle bar. Do I have a laser pointer here by any chance? No, it's fine. So the middle bar, you can see the lowest in the purple is Skinuva's. That's the lowest collagen type 1 response. That's what we wanted to see. Let's look at collagen type 3. It should be, if we theoretically believe Skinuva Scar cream outperforms regular silicone cream, you should expect it to have a higher collagen type 3. And guess what? It does. The median of those 3 shows that it's the highest. Really fascinating. And second to it is silicone treated scars, and third to that is untreated. So really cool data. Now looking at the bottom in green is normal, so you're not expecting a count expression from normal tissue for collagen type 3 because nothing's being done, and you're not really seeing that. So that's consistent as a really strong indicator of baseline data that we have. So putting those 2 previous slides together in ratio of type 1 to type 3, you expect the lowest type 1 to type 3 ratio to be the Skinuva Scar treated site, and guess what? It is. It's the lowest among the 3, and it remains consistent, and that's really exciting. Again, it's only 3 patients. There's a lot of argument to that. It's certainly a huge limitation. It's a pilot study, but the clinical indication is there, suggesting that there is some underlying genetic expression differences you're seeing with scars treated with Skinuva Scar versus just regular silicone cream. So really interesting. Fibroblastic response, you'd expect to see the lowest fibroblastic response with silicone cream treated scars, and you can see Skinuva has the lowest. Fibronectin. Fibronectin is also a genetic marker that we further investigate. It's one of the 7 that was affiliated with wound healing, and it's in order to high fibronectin levels are associated with the best healing scars, and we were able to see in Skinuva and also continued that trend. We can see that Skinuva Scar the highest response to fibronectin, followed by silicone cream, and then the non-treated was the lowest. Lysyl oxidase is really interesting. It's a hot topic. A lot of pharmaceutical industries are looking into this as a marker to help inhibit abnormal scar formation. Keloids and other really severe hypertrophic scars tend to have a really high level of lysyl oxidase that's expressed. And so we actually saw that our Skinuva treated sides had the lowest amount of lysyl oxidase expression. MMP9 is also found to be elevated in scarless wound healing. So we got to see that sort of consistency in Skinuva as well, having the highest response among the other locations biopsied. And the last one being cartilage oligomeric matrix protein. Again, it's found to be higher levels in fibrotic tissue, and we saw the lowest response in Skinuva Scar treated sides. So really exciting paper that was published, and I'm grateful to share this with you guys. Again, this is a small case series, but there's definitely a trend that's being demonstrated that with the use of topical silicone cream, and notably Skinuva Scar, you're actually seeing a favorable genetic expression consistent with optimal wound healing. Obviously, future studies would incorporate a larger subset of patients to undergo genetic expression, but again, thank you for your time and happy to entertain any questions you have.